Andy Prendergast. Andy's a Senior Public Services Officer and Senior Organiser for the GMB. We particularly invited Andy here tonight because Andy dealt with Matthew Kershaw, who's now the Chief Executive of our local NHS Trust here in Brighton. For those of you who are just visiting the town, the Brighton Sussex University Hospital's NHS Trust, in its wisdom, took Matthew Kershaw after he'd finished wrecking the South London Healthcare Trust on behalf of Jeremy Hunt and trying to close down Lewisham Hospital, and they appointed him as Chief Executive down here, so now we're dealing with him down here. So Andy dealt with him up in London, and we're going to ask him tonight if he's got any tips for us down here in Brighton and Sussex. Andy.
Right, thank you for inviting me here today. I've been asked to speak about two things. Firstly, what happened in Lewisham, which was the trust that was basically attacked by Mr Kershaw. And secondly, about the direction of travel in the NHS under a condemned government and the GMB's view on it. Now, in terms of the campaign to save Lewisham Hospital, I mean, it's fair to say this is a campaign that was very close to my heart, and not simply because it's my nearest hospital. Lewisham Hospital is a very well-run hospital. It's staffed by dedicated people. It serves a very, very diverse community and is much needed in the part of London. And we found that it was under threat about 2 years ago. And the reason why it was under threat had nothing actually to do with Lewisham. It came out of the South London NHS Trust next door. Now, the South London NHS Trust was formed in 2008, and it came out of 3 other NHS trusts in Greenwich, Sidcup and Orpington, all of which were spending more money than they had. And the government, the London Labour government, came up with a solution to merge the trust to create a single entity that was going to be big enough to deal with the problems. And around 2008, it was actually quite a significant political issue. Those with memories long enough will remember a certain blonde-haired candidate stood on the steps of Sidcup Hospital saying that he would do whatever it takes to defend their maternity unit. Presumably not just because he needs somewhere to deliver his illegitimate children, but there you go. Well, cut to 2010 and they closed the maternity unit, and funnily enough, Mr Johnson was nowhere to be seen. But over that period, and up until 2012, although they merged the trusts, there were still massive difficulties. And to the point in 2012, the trusts were losing £1 million a week. And the reason they were losing the money was relatively simple. They had a PFI debt of £20 million a year they couldn't pay for. They had management who were incompetent, who were wasting a similar amount. And there was also another reason, and that was simply the money going into the service didn't cover the costs going out. So the situation got so bad that in 2012, the trust became the first of its kind to go into special administration. Now, if you don't know what special administration means, anywhere else, bankruptcy. And what they did is they appointed a bean counter by the name Matthew Kershaw to resolve it. Now, bearing in mind this had been an issue that had been festering for over a decade, they gave him an impossibly short timetable to make all the changes that he needed to save the trust. And when he looked at it, he very quickly came to the conclusion that was apparently beyond the Department of Health, that actually it couldn't be done. And the only way he could do it was to make a grab for wherever the money was. And funnily enough, his gaze soon fell on Lewisham Hospital next door. Now, Lewisham Hospital was in surplus. SLHT was in deficit. If all they did was take a surplus from one part of the NHS and put it in another, I don't think we would have an issue. After all, it's a national health service that we're trying to protect. And if one bit is in surplus and another deficit, it makes sense for them to work together. But the problem was that Lewisham weren't just being asked to pay for the mistakes of SLHT. They were actually being told that they were going to lose services to do so. And when I say lose services, it was specifically its maternity ward, which delivers 4,000 babies a year, and its accident emergency unit, which covered 115,000 visits per year. Now, when you look at all of this, it's quite simply not fair. And one of the reasons it wasn't fair was that Lewisham actually has a £400,000 a year debt repayment for the accident emergency. And Lewisham were potentially going to be in a situation where they would have no accident emergency department, but they would have a £400,000 a year debt for a service that wasn't there. So when this happened, quite quickly we got involved, the public got involved. And you can imagine the outcry that greeted the government when they put these things forward. Patients, staff, GPs, trade unions, Labour councillors, Labour MPs, the whole community rose against it. Petitions were started, groups were formed, groups of patients, of GPs, of trade unions, of local residents, working together with local politicians to oppose a decision that was wrong. It was unconstitutional and it was unfair. Meetings were organised, every single one of them standing room only. Committees were formed. A Save Lewisham Hospital group was formed under the leadership of Dr. Louise Irving, an inspirational doctor who led the charge in destroying the arguments in favour of closure. Because this being the Tories, they weren't saying that this was a necessity. They were actually arguing that this was going to be good for patients. You know, we had numerous health people telling the government that there wasn't the capacity. We had ambulance drivers saying that they were being turned away from ambulance stations with red lights because they couldn't come in because they were too busy. We had members in theatres telling us about the waiting lists that get longer, and yet we had a health secretary in Parliament get up and say the solution was to remove capacity from a system that was already breaking. So the campaign continued. 25,000 people marched in support of Lewisham Hospital. Millwall even postponed the football match so they or their supporters or their players could march with us. 150,000 people signed petitions. Barely a window in Lewisham didn't display a poster to save the hospital, but the government carried on regardless. So our campaign, with the support of the Labour group in Lewisham Council, moved on to a new tack. We actually went to court. We paid for a judicial review, which actually was lodged under the government's own Health and Social Care Act, because we believed the closure was wrong and it was illegal. And we got up in court and thankfully the judges agreed with us. What did Mr Hunt do? He appealed it. He used our money to appeal it. Money that could have been used propping up a healthcare system was used to actually close a hospital. So we went back. We had a second judicial review. And you know something? We won that too. So Mr Hunt, he went to court twice, and twice he left with his tail between his legs and mounting debts to the department he ran. He knew he couldn't close the court legally, so what did he do? He changed the law. This has now led to Section 118 Clause 118 of the Social Care Act, which passed last month. If you don't know what this clause means, it means that any appointed trust special administrator can close any part of the NHS, no matter how needed, no matter how viable, with 40 days consultation. And this coming from a party whose 2010 election manifesto promised to, and I quote, stop the forced closure of accident and emergency and maternity wards so that people have better access to local services. So while I'm pleased to say the campaign to save Lewisham Hospital has done exactly that, not a day goes by when we're not waiting for the axe to be swung again. And this is something my union recognises that we have to fight against. And not just for the tens of thousands of members we have in the health service, but for the hundreds of thousands of our members who rely on it, for whom a quick diagnosis and fast treatment is not just a matter of life or death, but it's also the difference between keeping your head above water and going to the wall. The most common cause of homelessness in this country is health, something recognised by the millions of workers who are forced to turn up for work sick because they can't afford the day off, who live and work through the pain and have no alternative. For all the bad press, for all the problems, the NHS is one of the best health services in the world. It's affordable, it's adaptable, it's the foundation on which our post-war society has been built. It's not and should never be a cash cow for those who see suffering and want and see an opportunity to make a profit, who do everything to run it down, to sow the seeds of doubt to them and claim that the only solution can be found in the private sector, where we all know the wages at the top are far higher and those at the bottom are far so much less. The NHS has to be defended. It has to be defended as a public service, one free at the point of use, providing support from the cradle to the grave. I've been asked to address the question as to how we protect it together. Simple as that. We have to protect it together. Staff, patients, trade unions, politicians, and even businesses, who, let's not forget, save millions and billions, if not billions, of not having to pay for the very expensive health insurance they have in America, a system that costs 3 times what ours does and actually delivers worse outcomes. We need to protect this asset, not just from high-profile closures, the ones I described, but all of it. And before I finish, I just want to say one thing. I've done a lot of these speeches over the last few years, and one line I've repeated often is that the NHS is a right, not a privilege. But you know something, and I hate to say it, I'm wrong. I'm wrong because I've been around the world and I've seen a lot of healthcare system that doesn't have an NHS. The NHS is a privilege. It was a privilege our forefathers fought for, and it's a privilege we are obliged to fight for. Together we can protect it, apart we'll lose it. Thank you.